All right. Hi.
Hello. How's your Monday going?
Good.
Good.
This is a perfect timing for this because tomorrow I'm 6 weeks postpartum.
Oh, this is perfect timing.
This is perfect time. I was like, I should make a doctor's appointment or I can just go get a million origin answers.
Perfect. Let's do
Uh,
it.
all right. I'm Pia, and we are here having this discussion on behalf of Cluster. Please
Awesome.
just let everybody know who you are.
Yes, my name is Sarah Clampett. I am a women's health and pelvic health physical therapist at Origin. I'm also the clinical director there and do clinical operations as well. So do a little bit of everything. Intrigued.
All right. First question, which is I couldn't have written it better myself. How soon after a baby does sex feel good?
Great question, and one we get all the time. It really does depend on the person. It depends on, like delivery method, vaginal versus cesarean, if there's any sort of tearing or scar tissue, if there is, if you're breastfeeding, if you're not breastfeeding, there's just like so much that goes into kind of sex feeling good postpartum. It's, the fatigue is real, the hormones are different. And so it's kind of there's a lot going on. And so it really is patient dependent, but it should never hurt, which I think is like the big thing. Like sex should never hurt postpartum. It might be like a little uncomfortable, but it shouldn't be like sharp or burning or sandpapery. Like
if there is sharp or burning, we're supposed to stop?
Yeah.
Okay.
So if there's sharp or burning, you want to stop. You want to like go see a PT or see somebody, because what can happen actually is like if you do start having pain with sex, your brain will start associate pain and sex. And so even once those tissues have healed, or once whatever's causing it has, resolved, if your body's like, oh my gosh, this thing is painful, it's going to start to put up this defense mechanism. And so we don't want to train those patterns. Yeah.
Wow. Because like I said, I'm 6 weeks tomorrow. So last night I was like, should we have sex? And he was like, don't you want to go to the doctor first? And I was like, I guess, but like, I feel fine. And I was like, there's no way we can know unless we just try. Like, and I just thought, I'm thinking to myself, like, wow, this is like another new thing that couples have to go through together. There's like so many new steps.
Yeah. And, like take it slow the first time, make it a position that feels like safe for the woman. So where you can really control the speed and the depth. Because you'll feel what's happening in your body before you can vocalize it. So,
but it's good to know that if you do feel, what were you saying? You said burning, sandpaper,
sharpness,
anything that's not good.
Anything that's not good. You might feel a little stretch. It might not feel like exactly the same, but it shouldn't hurt.
Okay, that's very good to know, because I'm sure most women just are like, oh, I'm sure it hurts because I gave birth. Like, let's just keep going.
Yeah. And they'll have painful sex for like 6 or 9 months. And you're like, no, I know. Yeah.
Not cool. Okay. How can I recover from a C-section?
Another great question. So with C-section, the exit is just a little different. Obviously with delivery, they're coming out through an abdominal incision. And so with that, you have like a different but similar recovery. So when you do have that incision, kind of as early as you can start massaging that scar is actually the better, the best. A lot of women don't really want to like look at their scar, even if it was like an emergency C-section or if it didn't, go according to their birth plan. But as much as you can start like touching it and rubbing it and just massaging it, like even 3 weeks out can actually really improve the healing and the recovery. Because if you're not, putting input into it or kind of stretching and moving around those tissues, the scar can become more rigid and it can start to get like adhesions and kind of stick to those tissues underneath. And then we have to do a lot of scar massage and PT. So the more input you can put into it, the more, again, that brain body connection, the more the brain will acknowledge that it's there. You can start to, get that sensation back, because it's usually very numb and swollen. So the more you can move, the more fluid will be able to is pulled out of it, the more kind of awareness your body has around it. And then as you start to get back into core exercises, you'll feel it sooner and you'll feel it with more strength than you would if you weren't putting input into that area. Because if you don't use it, you lose it. And the brain body connection is very real. And so That scar massage is really important. And then just starting to get your muscles active as soon as possible. So, it's like we don't want to exercise for 6 weeks post-delivery, but every time you stand up, you're using your glutes. Every time you bend over to pick up a baby, your core is turning on. And so, starting with like glute squeezes and just TA bracing and just trying to wake all those muscles up as soon as possible can be really beneficial and can help with those activities that require muscles. Because we don't just, we're not limp, like our muscles are always firing. And I think there's a misconception about, well, I can't return to exercise for 6 weeks, so I have to do nothing. But, when you're standing up from a chair, stand up 4 more times. And that's almost just like little mini squats. And so just start to use those muscles in your body a little more, with a little bit more function and strength. And over time, you'll actually start to see that strength and that stability improve, which is important for all recovery. But I think for C-sections in particular, because you do have that incision going into your abdominal wall.
I think that's, I didn't have a C-section, but so many of my friends did. And that just, I feel like is so helpful because I feel like, again, there's so much like fear around everything. You do have to pick up your baby and you do have to stand up and you do have to, I feel like anytime you like move in your bed, you're using your core. So I think taking away a lot of the fear is probably super helpful.
Exactly. And like, you're sitting in a car, you turn around, like you're always using your muscles. Yeah.
Okay, the next question is, God, it's just sad what I read. How long after birth is leaking normal?
Great question. Also one we get a lot. 6 weeks. If you're experiencing any sort of like leakage, gas, urine in that first 6 weeks, that's normal. Your pelvic floor is still healing. Anything after 6 weeks is not normal. And that's when you should start to.
Everybody always makes jokes that forever you leak. So that's not.
You shouldn't.
Okay. No. That's good to know because it's always like, oh, for the rest of your life when you sneeze or you laugh or you jump on a trampoline, but we don't have to stick to that narrative anymore, right? Okay.
No. And I always kind of thought that it felt like because like other generations had to go through it, like we're all just kind of like going through the same thing together, and we can break that. We don't have to leak forever.
We have evolved.
Yes, we can get on trampolines.
I love my reformer, so that's great to know. I haven't had any, but I have so many mom friends that are like, I constantly, oh, I did this and I peed, and oh, I did this and I peed. God damn it. Like, so scary.
Yeah.
Is it right that pushing out when going pee weakens pelvic floor muscles?
Not necessarily that it weakens them, but you should never be straining to pee. So kind of the mechanism of peeing, kind of, Cliff Note version is your bladder fills with urine. The stretch receptors are like, hey, we're full. The smooth muscle inside the bladder that we don't control, it's similar to like the intestines or any other muscle in the organ, is like the detrusor is like, all right, time to go, squeezes. And with that squeeze, your sphincters, which are what kind of hold the end of the urethra, relax. And that's how you void. And so it should be a very kind of like passive thing. And so if you're squeezing and you're pushing and you're trying to force it out, it won't necessarily mean that your pelvic floor muscles are getting weak, but you're going to start to kind of mess up the way that they're coordinated with voiding. So they could actually become like too tight. It might affect when your body thinks it has to go. So if you haven't had that urge to go yet and you're doing like the just in case go, all of a sudden over time, your body's going to think like, oh, we don't have to hold as much urine. Like we can just go after, this much liquid as opposed to how much it should be holding. So the just in case go is not a good regular habit to have. But so it won't weaken your muscles, but it will definitely affect them in a not great way, if that makes sense.
The just in case go is the funniest thing I've ever heard. Just in case.
Like, just in case we're going to be out for a while, you just go just in case.
Are there any stretches or tips to help treat, oh my God, what is this? Vaginismus?
Vaginismus?
Vaginismus? What's vaginismus?
Vaginismus.
Oh my God, I'm learning as I go here.
Vaginismus is the
I've never even seen that word. I've never even seen that word.
Oh, well, here it is.
Yeah, that's crazy. Okay, go ahead.
It is like the overactivation or like tightness of the pelvic floor that makes penetration incredibly painful or impossible altogether.
Got it.
Yeah. So it's, dyspareunia or painful sex, it's kind of goes with that, but it's like impossible. So gynecological exams, like tampons, even just like one finger is typically excruciatingly painful.
Oh, no.
Yeah, but we treat that. But
Yeah.
to help with it, you want to bring like length and coordination back into that pelvic floor. So like deep breathing is very important because your diaphragm and your pelvic floor work together. So as you take that nice big deep belly breath, that diaphragm, goes into your abdomen, kind of pushes those abdominal contents out, and then puts a little bit of pressure on your pelvic floor, and they move together. So, starting out, just a lot of deep breathing, making sure you're taking those nice big deep belly breaths, trying to let go of that pelvic floor a little bit more. Mm-hmm. And then any sort of, like inner thigh stretch, hamstring stretch, glute stretch, foam rolling, anything to just bring down the tone and the muscle tightness in that area.
Oh, even foam rolling.
Yeah.
Great. How do you know if your pelvic floor is in good shape? And how do you know if you have a weak pelvic floor?
Great questions. Yeah. Great question. So anything with the pelvic floor, like anything abnormal or out of the ordinary is not normal. So it typically means something is going on. So if you're ever like leaking, during an exercise class, like regularly coughing and sneezing all the time, if tampons are painful, if sex is painful, if you feel like burning when you pee, anything that doesn't feel normal or right, or if it's like anything that makes you kind of second guess, that usually means that something's going on with your pelvic floor, and we're usually like just told to ignore it and move on, and it'll get better over time or whatever. But yeah, anything out of the ordinary means that something is happening. And if your pelvic floor is weak, that can be, again, like leaking with exercise, leaking with coughing, sneezing, like a sudden urge to go and you just can't make it to the bathroom in time, or even pain, because what can happen is that when muscles are weak, they are overworked. And so they can actually go into like a spasm or a tightness, which can then cause pain. And that's because they've been pushed past their ability to work. So think of it like a hamstring cramp, but in your vagina. Like your hamstring's not strong enough to do what you need to do. It seizes up on you. The same thing can happen internally. And then all of a sudden, sex might be more painful. You might just feel like tight and achy. And that's stemming from the pelvic floor being weak instead of doing what it needs to do, which is why the big myth that Kegels fix everything is a myth.
Do you see women, I'm just going to freestyle some questions here. Do you see women often come in, to prepare for birth that already have weak pelvic floors? Like, is this something that even if you're, know that you want to have children one day, but you don't right now, something that we should just, kind of include in our workouts? Yeah. Yeah.
I love the, the patients who come in, they're like, I'm thinking about getting pregnant, or like, we're actively trying. And like, I just want to see what's happening. So I know what my baseline is and know what to do. And I'm like, yes.
I know. Because our country doesn't do anything. Well, first of all, they don't do anything like this regardless, but we're not a country of preventative medicine by any means.
No, we are not. So it's the prehab. It's like pelvic floor prehab is what I like to call it. And coming in, even just like the anatomy of it. Like most people don't even know what it looks like. And then you show them a pelvic model and they're like, oh, that's what it is. It's like, yes, this is inside you. This is your body. Let's learn to use it and love it. But yeah, I think any person with a pelvic floor, which is everybody, should learn about it, know where they are, because when something does happen, or if something isn't normal, they know what their baseline is and can be more informed and know what's going on.
Where I had a multiple aha moments during my pregnancy, but one of them was that this narrative and I got really irritated about it with other people. This is what everyone kept saying to me. Like, this is your time to let go, this is your time to eat whatever you want and sleep whenever you want to, and let everything go. And I think that is I think it's like a horrible advice to give to a pregnant person, because you need to prep your body for birth and the child that will be here who will not allow you to do whatever you want whenever you want. I feel very physically strong from the exercises I did during my pregnancy. I know I can, get back into working out this week feeling good, and it benefits my child and myself. So, I mean, what are your thoughts on on like undoing that narrative?
Yeah, I mean, labor and delivery is a marathon. And so it's something you need to train for, and it's something that you need to prep for. And, I think the idea of just like, take it easy, like you're pregnant, just like
Which you should.
lay
I
and eat.
slept a lot. I took naps. Of course, I indulged, but not all day, every day.
Right. And, it goes back to like, if you don't use it, you lose it. So if after, muscles start to, decrease after 2 weeks. And so 2 weeks of being sedentary or not being as active, like that's going to start to show in your body. And so I think it's about finding a balance of staying active, making sure you're strengthening and you're preparing for, what's coming next, but also, yeah, you're taking the extra nap and listening to your body, because there's so many change, like your blood volume doubles. So your heart is working harder. So you're going to fatigue quicker. And like, that's okay. Like, you don't have to be the same high active person that you were before, but still maintaining some of that, the strength and the movement and the exercise as you're going into, delivery, the 4th trimester, and what comes next, I think is super important, because, after you deliver, you're handed this tiny human, and you need to have good posture and a strong mid back, because that's what you're going to be doing all day.
I cannot believe how physically straining breastfeeding. Nobody told me that. My back and neck, I mean, I'm constantly going to the chiropractor. My hand is sore from holding her head, so she's in the right position. I mean, and I worked out up until before I gave birth. So I couldn't imagine if I didn't, how I would feel right now.
Mm-hmm.
Can you give us a visual for Kegels, how to imagine us being able to do it correctly?
Yeah. Well, visual, I will use the pelvic model so everyone knows what the pelvic floor is. And we'll go from there. Yes, so the pelvis and the pelvic floor, mysterious thing that lives underneath your pants. So your pelvic floor has 3 layers. It has this outermost layer here, your middle layer, and then this deepest layer, which really much sits like a bowl or a floor at the base of your pelvis. And so together, those 3 layers have to be able to contract and relax to give you a functional pelvic floor. And so because you have those 3 layers, a Kegel really is kind of 2 things. It's a squeeze and then a lift. And so there's lots, because you want to close those openings and then lift up that bowl. And so there's a lot of different visuals or cues that people use. Some of my favorites is imagine like you're almost trying to, these are kind of, I think they're kind of funny. Like you're drinking through a straw with your vagina. So you're like closing and then you're lifting. And so you're getting that like full pull, and you'll feel it from kind of your pubic bone all the way.
Anyone you say this to who doesn't make the face that I just made, which is that like I'm totally doing this as you're saying it.
Everybody does it, and their eyebrows always go up a little bit. They're like, so that's one that I love. There's also like like picking up a marble or picking up something. So you're kind of closing around it and lifting. So some things, some of the visuals, it's like the claw game. Mm-hmm. So like you have it, you're squeezing and you're lifting around something, or there's one on the internet that's very popular. It's like the jellyfish. So you're kind of like squeezing as you lift and then letting go. So those are some of my favorites. The straw one is actually really what gets people like, oh yeah, we can get that. But you can also think about even like holding in gas in an elevator, like squeezing and lifting up. But it's really anything that's going to get both the squeeze and the lift is going to be what you want to be thinking about and cueing yourself.
Okay, good. That makes sense. Also, so does the elevator analogy, because really the urgency is really there in that analogy.
Like, no, don't, not yet.
Tiny space. I have a question for you. Those are all of our audience questions, but sorry, now all my dogs are gonna bark. I have a question for you, which is, clearly, obviously, you're not supposed to do any strained exercise in your first 6 weeks, and I don't think anybody should either, because you're exhausted and you should give yourself that break. But I had such an urge to like, and most women do, of course, like to just kind of like, like move around and like get, feel my hips and kind of get them back into place. And is what are, how soon should you be like stretching and kind of like trying to like move everything? I don't know. The term I would say is like back into place essentially, because that's what it feels like.
Yeah, great.
That.
So for like the stretching, the mobility stuff, it's again kind of what feels right. I usually encourage like wait, up to 2 weeks, because in that first 2 weeks, your uterus is shrinking back down. There's a lot kind of happening as things start to settle. Your hormones are, your relaxing goes down, your estrogen goes down. There's just a lot of shifts that's happening. So usually like, but if you're laying in bed and want to like, stretch, like it's fine. But usually try to wait like, a couple weeks until it's any sort of like kind of intense, deeper stretch, and just always listening to your body and making sure that it feels productive and appropriate. You don't want to like push it to pain, or if it feels weird or wonky, obviously want to stop. But stability exercises like glute sets, just like squeezing your butt cheeks together, core sets, like activating your core, you can do in the hospital. Like you can start to get those things firing pretty immediately, which will then also decrease that urge to be like, oh, like things don't feel like they're in place, because you've already started generating stability in the area.
Okay. And then this is my last question for you, which again is just for me. If you were going to just hang out with one of your if you were like having a cocktail with one of your girlfriends and she's like, oh, I'm pregnant, whatever. If you were going to say, okay, with all the knowledge that I know, just promise me you're going to do this one thing, what would that one thing be?
Learn to push and practice push before you go into the delivery room.
Ooh, good one. Because that was so shocking to me when they said push. I was like, I don't have a point of like where and how. And
so again, yeah, not all births are vaginal, and but I think if that's on the table, I think knowing how to do it, what it should feel like, and knowing what positions you feel it the most in, and even just like cues that work for you, like that you can give your doula or your partner to kind of help you like, oh, remember that thing, because in the moment, there's lots of people and you might have an epidural and you can't feel it. And it's just, you're like, I don't know what's happening.
Yeah, so I couldn't feel anything.
Yeah. So if your body knows how to do it, it has that muscle memory and it can default to it.
How do you practice push?
So we do it with our patients, usually again, starting like 34, 35 weeks. So, push is a bearing down, or it's like having a bowel movement. Like you want to be able to kind of lengthen that pelvic floor.
Going to the bathroom aspect.
Well, so that's what it feels like. And so we can do it with patients in the clinic. We can even have them, like undress, kind of insert one finger and be like, push our finger out, and like give them that feeling of like being able to kind of, lengthen and push. And we practice with different breathing. So like, a lot of times, like we encourage patients, if they can, do open mouth breathing while they're pushing, but you also want them to know how to do it with holding their breath, because in the moment there could be someone telling them like, hold your breath and push, and that might just be what ends up happening. So yeah, doing those with open mouth breathing, but also with, holding your breath and more of that like bearing down on your back, on your side, on all fours, depending on what your birth plan is, and knowing like where you feel it the most and where your body likes it. I think it can be such a powerful tool.
Absolutely. Because when they said push and I pushed, I remember looking up at everyone and be like, what the fuck? Like, I don't feel, is anything happening? Like that was crazy. Like you prepare for your birth and you think you know everything if you're someone who overly prepared like me. And then I was like, I'm lost here. And there are women that I know that, I have a friend who pushed for 4 hours. So I can imagine you want to know what you're doing, especially if you don't know how long it's going to take. That's good advice.
Yeah.
I love that. Okay. Well, thank you so much.
Oh, you're so welcome. It was such a treat.
Thank you. So to let everybody know, you obviously have multiple physical locations, but everything can also be done online, correct?
We have virtual appointment. We do a lot of virtual work. We see patients in their homes, wherever they need to be seen. It's been silver lining of COVID.
Wonderful. All right. Thank you so much.
Awesome. So nice to talk.
You too. Bye-bye.